It's not only the 20 million or almost 22 million people we have diagnosed in this country, it's several hundred million people worldwide, and it's just increasing. We have an epidemic of diabetes going on in this country.
The danger is not only the more than 20 million Americans that suffer from this new concept of diabesity, but the people who are unaware that they have a silent killer. Nearly 50,000 people in the East Los Angeles area have diabetes. That's not surprising, since 1 in 7 Latinos and 1 in 4 Mexican Americans over the age of 45 are diabetic. At the East Los Angeles Center for Diabetes, about 200 patients receive services every month.
So it's really an epidemic that's just getting bigger and bigger every day. For the adults, it's mostly type 2, and then we also have type 1 diabetes in the children that we deal with every day, and also in our population specifically in East Los Angeles, it's the young Latino women who are pregnant and develop diabetes, and then it's the older Latino males and females that are dealing with diabetes, obesity, hypertension, hyperlipidemia. It's this metabolic syndrome that we see in these patients, and they suffer the biggest burden from this disease.
That's why White Memorial had a vision. And in early 2000, the East Los Angeles Center for Diabetes was created to provide prevention, screening, and educational services.
Some of the things we are going to encourage for your diabetes is to increase your fiber intake and eat a lot of vegetables. They also have 0 carbohydrate, so if you eat a plate full of a lot of vegetables like salad and things like that, they'll help.
Ruth has been teaching people how to control their sugar levels. But most importantly, she has been saving lives through education and changing lifestyles in order for those patients to coexist with the disease.
Eventually, if they have enough education and information, they can do very, very well. But we can come and show them, for example, what their food portions are. For example, we can teach them that half a cup of beans measured has 15 grams of sugar or carbohydrate. But they have to go home and they have to continue doing these things.
The race against diabetes started 7 years ago for Diana Avina. She was only 7 when at White Memorial she was diagnosed with diabetes type 1.
They talked to me saying that now I have to eat more fruits and vegetables to control my glucose, and I had to exercise now more often. I had to eat less junk food. An example would be I had to eat less hot Cheetos.
At such a young age, Diana is an expert about diabetes and knows how to take care of herself.
I'm gonna poke my finger, and as you can see, I'm gonna put a sample of my blood in the test strip, and it will be reading my sugar in 92. It's perfect. I really don't think there is a difficult part of being diabetic. As long as you eat healthy, you exercise, and do what you're supposed to do, your diabetes should be maintaining, and you'll live a normal life like everyone else.
Diana is a wonderful child. She is so delightful to take care of, and because she is so motivated and disciplined and willing to do what she needs to do to keep herself healthy. And she's a great little athlete. And of course, exercise is very important in managing diabetes, as well as the diet, and checking blood sugars and taking the proper amount of medicine. So I have a lot of respect for Diana and her mother and her family. They've done an excellent job. I wish all my patients were like that.
The message is education. That this isn't a death sentence for a patient to be told they have diabetes. It's the beginning of a change for them, both in their lifestyle, in what they do in terms of what they eat, how active they are, and a lot of times it's how they're going to be tied to their different medications. Some of these patients will be using 4 or 5 medications for their control of their blood glucose.
Fortunately, leaders in our community and the government recognize the severity of this issue and are turning their attention to this epidemic in East Los Angeles.
Since middle school, I've been running marathons. When I'm older, I still want to be a role model to other diabetics, and I want to run marathons for life.